So the APACT study, as you said, it's an adjuvant study. Patients have been resected. They've either had an R0 resection or an R1 resection, which is a close margin, and went on and then had to have a CA19-9 level that had been reduced down to below 100. And then they were considered to be eligible for the study. And they were randomized to either getting gem, nab-paclitaxel versus gem. There had already been a study, a positive study, the PRODIGE study, FOLFIRINOX versus gem, which was very positive and has been practice changing. There was also a study that was positive as well, looking at capecitabine and gemcitabine versus gem. So we were already dealing with an atmosphere that had already had 2 positive trials. So it was unclear, when this trial was going to be completed and read out where it was going to fit in. And it actually was negative in a sense because its primary endpoint was disease-free survival. And they had an independent, they had central reviewers and then investigator reviewers. And the central reviewers, in their estimation, there was no difference between the recurrence rate in patients who are on nab-paclitaxel and gemcitabine versus the investigators who detected a difference, which was sort of in line with their assumptions. But in truth, the differences were minimal. And whether or not you believe the investigators or the independent reviewers, I think that it's very unclear to me that gemcitabine nab-paclitaxel, which is already effective in the metastatic setting, has really shown enough of a benefit in the adjuvant setting to become really a standard of care. And I think it's really going to be relegated to the metastatic setting.